Join our August School Mental Health Community Practice webinar. We're taking the time to join our August School Mental Health Community Practice webinar. We're very grateful to having the IDA partnership facilitating and recording our webinar as always. Thank you, Mariola, for your support and continuation of that. I'm really excited to have our presentation this afternoon on HealthLinkNow and the partnership with the Yellowstone Boys and Girls Ranch, as well as just the broader services that HealthLinkNow can provide to folks, children, youth, and families across the state of Montana, as well as some other states in the Northwest region. So we have Christy Beal and Kim Chenard from the Yellowstone Boys and Girls Ranch, and Nick Little with HealthLinkNow. With that, I'd like to just remind everybody that if you have questions, we'll take them at the end, and you can write them into the chat. Mariel and I will monitor that. So Christy, Kim, and Nick, you don't have to worry about that. And I appreciate your time. If you would like a CEU for today's webinar, please email me directly. You can see it in the participant chat box with your full name and a good mailing address, and we'll get that taken care of for you. Thank you again, and go ahead, Christy, Kim, and Nick.
Hi, well, welcome, and thank you for joining us today. I'm Christy Beals. I'm the Chief Development Officer at the Yellowstone Boys and Girls Ranch, and today I'm here with Kim Chenard, the Director of School-Based Services, and Nick Little, the Clinical Development Director for HealthLink. And we're here today to tell you a little bit about our journey in regards to the telemedicine grant that we received about a year and a half ago, and the process that we went through and the lessons learned. So today we can highlight for you the good, the bad, and the ugly to share with you just the different pieces and opportunities that we've learned as we've gone through this process. Just a little bit about Yellowstone Boys and Girls Ranch. We are a 400-acre working ranch at our main campus, and so we have currently, on average, about 70 kids who live at the ranch in our residential program. We, on average, have 40 kids who are bused in daily for our day treatment program, and then we are in the community-based program. Our main office in Billings is in Garfield School, and through Garfield School, through community-based services, we offer case management, home support services, therapeutic youth mentor program. We have therapeutic foster families. We have about 30 schools in which we provide CSCT, and we also have a group home up in the Lewistown area. So we are spread throughout the state, serving over 650 kids daily, and we're incredibly proud of that. So YBGR, understanding the challenges that we have in providing mental health services in rural Montana, we applied for this grant with several community partners, and we were fortunate to receive the $500,000 HRSA grant. So our goals basically is once we receive the grant, it's an equipment-only grant, and we worked to choose the right equipment and went through a process and a bid process learning about the different types of equipment and what would be best utilized. And then we worked with our partners to install the equipment in our different schools. So what you'll learn about today is our partnership with the school-based programs specifically through our community-based programs, and then the process that we went through. Our second goal after installing the equipment was really to figure out how to create a program to improve access to mental health care in our schools, understanding that 85% of the kids that we serve in our school-based programs are Medicaid eligible, and over 20% of kids throughout the United States, so children and adolescents, have mental health problems. So there's obviously a need and a way that we could make a positive impact.
So this is Kim Chenard, and I just wanted to do just a brief overview of what school-based services is, specifically what our CSCT program is, Comprehensive School and Community Treatment. And I recognize several of the names on the call today, so I won't waste anybody's time with going over this too concretely. But obviously some of the benefits of school-based services are that we can provide therapy directly in the school setting. So kids and their families don't have to schedule appointments that take away from classroom time or just their general structure that they get during the school day. It helps parents so that they don't have to take time away from work. Their child can meet with the therapist during the school day around the school schedule. So the therapist provides individual, group, and family therapy along with a behavior specialist who does the majority of behavior interventions. Some of the benefits that we see, obviously, is that students have increased attendance. A huge benefit is that we provide services year-round. When students aren't in school, we continue to provide therapy and behavior interventions in collaboration with the youth individualized treatment plans. I hear from school administrators frequently that once they're in the CSCT program, they see a decrease in discipline referrals. A lot of times our staff can go in and sort of be the in-between. The teacher may see a discipline issue or see the child starting to escalate, and they can call our team there, or if they're not already there, and help de-escalate that situation before it gets to a discipline referral that would have to require them being sent to the principal's office. We also see a lot of increased communication. That communication is between, primarily we see an increase between the families and the school. A lot of our parents that we work with have gone through a school system that maybe they didn't have a positive experience with themselves. So when they all of a sudden have a child who's in the school setting, oftentimes we find that some of their past feelings about the school is being projected into what their child's dealing with. So our team can come in and sort of be a liaison between the school and the family, and therefore increase communication between those entities. Some limitations of our school-based services, I would say the most general one that we hear across the board is funding barriers. Being 85% or even over 85% Medicaid eligible, we find that a lot of schools are making referrals for kids that don't have Medicaid. And oftentimes parents either can't afford the copay or the deductible that goes along with private insurance. So they end up saying that they're not interested in the program, which is a huge barrier to getting kids the help that they need. Access to services in the rural area. We hear all the time that a lot of families will have to drive at least an hour, if not further, to get different type of mental health services or even sometimes the appropriate medical care that they need. In addition to the services being so far away, there's extremely long waiting lists. We hear frequently that it's 30, 60, 90 days out before they can see a provider such as a psychiatrist.
So this is Nick Little with HealthLinkNow. So adding on to that, what really happened was you have Yellowstone Boys and Girls Ranch, which is providing school-based mental health services, and this opportunity to utilize technology to bring another piece of that, another piece of mental health services into the schools, which is the psychiatric piece. And that's really where HealthLinkNow comes into play. After several conversations with Kim and Christy, we found kind of a way that we could potentially make this partnership work. Thanks to the CSCT program, it makes it possible to bring the HealthLinkNow into the picture so that we can partner with them to help provide the psychiatric piece. A little bit about HealthLinkNow. HealthLinkNow is a telemedicine company, our focus being telepsychiatry. Roughly 2 years ago, we were awarded a large innovations grant through the Center of Medicaid and Medicare. And basically, to keep it simple, the overall objective was how can we utilize our web-based IT platform to increase accessibility to mental health services in Montana, in particularly rural areas. As many of you are probably aware, rural areas struggle the most to have accessibility to mental health services, often having to drive well over 100 miles, take days off work, pull kids out of school. Whatever the situation may be, it's quite difficult. And that's not to mention the long wait times to actually have a psychiatric consultation take place. So with HealthLinkNow, we're trying to bridge those gaps. And with this grant, we came into Montana. We're also working in Washington, Minnesota, and Wyoming. But me, in particularly, working in Montana, we've been working with healthcare facilities, critical access hospitals, federally qualified health centers, tertiary hospitals, and now working with nonprofit organizations such as YBGR. What we can provide is accessibility to basically the full range of treatment for mental health care. That's from pediatrics to geriatrics for with psychiatrists, psychiatric consultations and med management, as well as accessibility to the therapy piece of it if that is needed. Now, a lot of the partnerships that we've
I'm close on this, but I could write another one.
That a lot of the partnerships that have taken place between HealthLinkNow and healthcare facilities are focused on more of the psychiatric piece, because that is usually what's missing. And the way that we connect facilities to our psychiatrists is by our IT platform, which is web-based. And when I say web-based, why that's so important is because previously this equipment that was utilized for telemedicine needed its own IP
This is
address.
really good. We're going to make it longer. Okay.
And most of the equipment was stationary.
I have to get back.
And so it was not easy to work with, not to mention the fact that
Yay! That's good.
I need this week.
a lot of inflation, and as well as
The leader has muted your line. To unmute your line, press #6.
okay, are we back?
Can you hear us, Mariola?
Okay, perfect. Thank you. What I was saying was the web-based platform helps utilize just simple forms of technology, a PC, laptop, an iPad, and all that's needed is a basic wireless connection. So it makes this much easier to do, plus it cuts out that cost, which can range from $10,000, $50,000, $100,000 for telemedicine equipment. And so now with this partnership, what we're going to be able to do with YBGR is we're going to be able to bridge the gap of accessibility to psychiatrists. And we take care of all the billing on our end, and we'll be able to provide consultations and med management right inside the schools. So, that being said, I'm going to turn it back over to Christy.
So this next slide is for you to read. We'll give you a minute. No, I'm just kidding. But this next slide really just demonstrates why we chose the route we did. So we had to find an innovative group of administrators that we were already providing services to in their school district. And so we chose to partner with the administrators up in Dillon, primarily their primary and middle school. And they were really excited. So they've already taken on the concepts of MBI, and they are very forward-thinking in regards to providing good mental health services for their kids, not as a reactionary state, but how can they continue to keep their kids engaged and what services we can provide to not only keep the kids in school, but keep those kids in their community. So as we were looking for good partners, it just became evident that this was an area of need. Meeting, they were in a rural healthcare setting. We were currently, YBGR was currently in the school providing CSCT programming, and we found administrators who were not only excited about the possibilities of bringing in telepsychiatry, but were also very honest in sharing with us the importance to them of providing a continuum of care. So as the kids were going through school and needed to have those referrals out to other parts of mental health services, but also bringing in the loop of having that continuum of care with telepsychiatry and how we could best partner with them to provide that service. So the partnerships was a big thing. And the other piece is how we got to even partnering with HealthLink. When we got the grant originally, we had basically narrowed it down to 3 options. Do we bring in providers that locum providers that are very expensive, and basically we would pay for their service prior to providing the service? Or do we hire a psychiatrist, which just hasn't been something that we've been able to do? Or do we partner with a company like HealthLink, who's also kind of paving the way and does their own billing? And so it just became a really natural fit. And understanding that the majority of these kids are Medicaid population, we had to find something that was also a sustainable business model, that we wouldn't be over our heads with the overhead costs, basically, of providing the services. So this has really taught us a lot about the community partnerships, not only from a clinical side, but then also finding a school that was willing to trial something that we could learn from and then hopefully replicate in the future.
So why is mental health important to education? Most of us know that mental health is directly related to children's learning and development. And the best example that I like to use with this is that we're expecting in the academia world that kids come into school, they sit down, they get their pencil out, they get their paper out, and they're supposed to concentrate for the next 7 hours on math, English, history, science, and we oftentimes as adults can't do that ourselves. We have situations that are in our head that we're thinking about what's happening after work. The kids are thinking about what's happening after school. A lot of the students that we work with in the school-based services program are socioeconomically in poverty. They don't always know if they're going to have food on the table. They don't always know if there's going to be an adult at home when they get home, or if there's going to be strangers in their house. Sometimes we have families that have up to 11 adults living in a single-wide trailer home. And then we still expect these kids to be able to do their math work and expect them to be able to concentrate on their science homework and whatnot. So our hope is that by increasing mental health awareness through our partnership with HealthLinkNow and through our partnerships with school-based services with the different public school settings that CSCT is working with across the state, that ultimately we can all become mental health conscious. It intersects in all parts of a student's life, whether it's peer relationships, whether it's adult relationships, how they respond to their teachers, how they respond to their friends. All of that is interconnected with mental health. Whether I've heard frequently from teachers that have students up to 20, 25, 30 kids in their single classroom, and they have 1 or 2 kids that can totally disrupt the entire milieu, disrupt that classroom setting so much that the teacher's concentrating on 1 or 2 students and taking away from the 25 leftover students who aren't getting the support that they may need in that situation. Our hope is that through these partnerships, we have found that schools who really embrace mental health, they're perceived as more warm, they're more accepting. Students don't have to feel as threatened when they know that maybe their mental health concerns are being recognized and being dealt with. I think oftentimes schools that aren't as mental health conscious tend to ostracize the kids unknowingly. They don't do it intentionally, but just by being so strict and rigid on that, we have to do our math, we have to do our science, we have to go to PE class, and not recognizing that maybe that youth needs to be learning more social skills, learning more coping skills, making sure their basic needs are being met, that there's going to be food on the table that night, that those things have to be addressed before they're going to be able to work on their academics.
So I guess it's important to understand, to then pose the question, why school-based services? It's really because mental health services provided within the school is a child's natural settings. In so many cases, I mean, they spend basically 9 months out of the year in school. Friends, the teachers, support systems, school administrators, etc., that are available. School is a natural setting for a child. And not only that, it really helps overcome a lot of different barriers that compared to outpatient services. A lot of times, I believe it's between 40 and 60% of individuals that are visiting mental health care professional will stop seeing that professional by basically after the first or second visit, and usually it's because of certain barriers. And specifically with children, as we see here on the slide, it helps overcome barriers such as lack of transportation, the financial constraints that are often associated with healthcare, and also the stigma surrounding mental health care. There's a lot of facilities that we've worked with where some of the responses that we're getting back on some of our surveys are, what they really love about it is the anonymity and the fact that they don't have to park in front of a mental health center when they're coming in to do a consultation. Many times they're just parking because our partnerships are with healthcare facilities. They come in and nobody knows exactly why they're in there, but they can go and have a psychiatric consultation without feeling like the whole town knows. And when you get into rural areas, oftentimes you see the same people everywhere. You can see them at the gas station, the store, and the restaurant all in the same day. So it's really important for a lot of individuals that are in rural areas to know that who they're seeing is not necessarily somebody that they're going to run into on a daily basis. The other important thing regarding school-based services is you have especially in our case with HealthLinkNow and Yellowstone Boys and Girls Ranch, is you have a fully integrated team that's providing what I believe to be unparalleled support for each child that's receiving care. Not only do you have the support system from the school, maybe the teachers, as well as school administrators, etc., and this is also with parents as well, but now you have the therapy piece of it being provided by YBGR staff, as well as the psychiatric piece being provided by HealthLinkNow. So this child is just getting, to repeat, unparalleled support. So there's a great support system for this child, which is obviously going to affect the outcome. The other reason why it's really important is you have the increased accessibility to child mental health providers. The community partnerships that we formed are specific to children, adolescents, etc. So what you're seeing is this, instead of potentially a child being referred to a psychiatrist or referred outside of the school settings, it's conveniently located right in the school where the child is spending a majority of their time, which is helping increase accessibility to child mental health providers.
So what this slide shows is where we're located in the two different entities, HealthLinkNow and Yellowstone Boys and Girls Ranch. And as you can see, we're spread in different parts of Montana. Our goal really with this project is to pilot the project, the demonstration of telepsychiatry in Dillon, in collaboration with HealthLinkNow, and work out the kinks in the workflows, find its barriers, and then along with that, some opportunities to fix those barriers, and then to replicate that service in other areas that we've already identified as high-need areas.
You know, and speaking on HealthLinkNow's behalf, right now we have approximately, I think we're right at about 40 partnerships throughout the state of Montana. Now, obviously you can't see all those on the slide, but it goes from all four corners, from Libby to Sidney to Eagle-Acca, even down to Dillon. We're working with, like I said, a variety of healthcare facilities, but what's really exciting about this partnership is the opportunity to expand our services outside of healthcare facilities. This partnership is really pioneering a new form of mental health care delivery for children and adolescents. And by doing so, we're really hoping that we'll be able to provide a perfect example of what other communities and other states can do to help increase that accessibility to mental health care resources, which obviously will increase each individual child's success within the schools that they're functioning in, so to speak.
So lessons learned. You might be surprised, but there's been many. So we were just thrilled to be recipients of this awesome grant, and we got it and we started pulling together really our steering team around the project. And as we identified which path to take, it just actually ended up getting more difficult as time went on, and just the level of detail that was needed to really develop a program, because we didn't have a program. We got the equipment and then we're going to develop the program. And it just, I think a common thread was, why is this so hard? Because it was difficult and it was challenging, and you have a lot of different people with a lot of different levels of experience and knowledge, but it was trying to pull that all together. So on this slide, what you'll see is a picture, and this is actually in Dillon, but this is one of several sites that we went to go visit to just kind of see. And what our goal was originally is to roll out the equipment and then to have staff use it for interaction, so meetings. And like I said, we're spread out throughout the state, so if you needed to call somebody who's in a different town, we challenged the staff to use the equipment versus the phones. And when we would go to the sites, this is what we found, is that the equipment was our worst nightmare, hidden in closets, literally, or in the basements of some of the facilities, covered in dust. And so we kind of took that as, okay, let's step back and figure out how to redo this. And in our very first meeting with a broad group of staff, we said, okay, your only homework is to go and make sure that the equipment is in a place that's plugged in with a phone line or a data port and a plug-in. And so what we learned is when the equipment was rolled out originally, we didn't even put it in a place that was feasible for not only workflow for our staff, but a place that had the basic tools to hook the equipment up. So we've really taken baby steps to try and backtrack and do this right. And so since I'm picking on Dillon and showing that their equipment's in a closet, I think it's fair for me to tell you when we went back, the administrators were so supportive that they've actually moved the equipment to one of their main conference rooms. And in our last visit with them, with HealthLinkNow, talking about the program and really wanting to get this established, they've moved it to an area that's easily accessible, that kids can go into the room and have their meeting via the equipment with their psychiatrist, but we can also keep that area confidential. So we've just made leaps and bounds, which has been absolutely awesome. You know, the other pieces of lessons learned that we've come across is just the scheduling piece of it. How do you schedule the appointments? How do you make sure a room isn't being used either by the school or by our own staff in the school, or even throughout our organization? And so figuring out different mechanisms for scheduling. Office space, we have staff in some of the schools, this might surprise you, that are in closets versus classrooms. And so it's really figuring out space and occupancy and how do you maximize that, and again, use it, because if it's not in a place that's going to fit their workflow needs, they're just not going to use it. And communication was a huge issue in figuring out how to best communicate with people. And just as we got going with our training and we'd identified kind of what you'd call super users at each of our sites, our server was blown out, and so then we couldn't even get onto the equipment, much less do our training. So good lesson learned, one step forward, a few steps back. And that was one of the training obstacles, is one, identifying who should be trained, two, training people on different types of equipment. So we have the telecoms that you see in the picture, but then we also have iPads that have the app and are a little bit more user-friendly, or at least more friendly in regards to space and tying that into workflows. And then really identifying roles and responsibilities, who's responsible for what, and we're still working through probably all of these issues. We're really excited because we're having our kickoff meeting here this month with HealthLink and having all the people at the table, and so our disclaimer to them is it's not going to be perfect, but we're going to roll it out and we're going to figure it out as we go, and they know that they're the first site for YBGR and that they're a unique site for HealthLinkNow in regards to providing the service. So we're just really excited, but it's been a difficult process, and it wouldn't be fair to say that it's been easy. But having highly engaged staff and people who want to see this happen and people who know how important it is for us to be able to provide these services to our kids and families is really what makes this a labor of love. So going back to the last slide, why is this so hard? This was a quote that was posted to our Facebook page in June, and it reads this: I was a resident at YBGR from December of 2007 until August of 2008, and with their support, my life was changed forever. I went from a depressed, suicidal, angry young man to a happy, appreciative, optimistic teen. Because of their support, I just graduated from a public high school and won the 2 most prestigious awards given out by the Board of Education. Thank you, YBGR. You saved my life. I am forever grateful. And that's why we've gone through this process, is because if we can save one kid at a time and give them the services that they need to have to be successful or to at least live a quality life, that's why we do the work we do.
So to add on to that, what I wanted to do was kind of find an example where we've had some success working with an adolescent or a child, or at least someone under the age of 18. And there was a great story, and this individual was located in a small community along the High Line, northern Montana, and she had dealt with severe depression, and she had been on several different types of medication, and she was struggling continually, not only at home but also within school. And one of the biggest issues was the fact that the psychiatrist that she was seeing was one of the only ones within about a 150-mile radius, and it would take weeks to get in. So as they're trying to balance these medications for this young individual, there would be times where she was struggling and she was unable to get in to get the medication changed, up the prescription or subtract. Either way, she was struggling to get in. So she would go weeks dealing with some of these issues before she was able to get in and see a psychiatrist and have those medications adjusted. And so with this partnership with HealthLinkNow, what we were able to do is, since it was located in her hometown, our company policy is when somebody is referred to HealthLinkNow within one of the facilities by their primary care physician, we will see that individual in 10 days or less. Those are business days. So what we were able to provide this adolescent was timely accessibility. So what she was doing was trying to get that balancing act with medications and coping with the severe depression. And due to the fact that she had timely accessibility to a psychiatrist, she is stabilized and is now doing much better at home and in school. So what we would like to do now is just kind of open up the floor for some questions and anything that you guys would like to know more, maybe elaborate on something a bit more, but just anything, any questions that you would like to ask us.
Nick, Aaron, this is Mariola. If you'd like, I can unmute everybody, and since this is not a big group, we can see if this will work better, okay?
Perfect, that'd be great.
The leader has unmuted your line.
All lines were unmuted now, so please, you can ask questions through the chat or online.
Nick, I'm wondering if you could talk about the availability of HealthLinkNow to other partners across the state and what you might be able to provide if people are interested in contacting you.
Well, that's a good question. Really, what we can provide is similar to what we're doing with Yellowstone Boys and Girls Ranch. As long as schools are utilizing the CSCT program, that opens up the opportunity to bring in that psychiatric piece. And so in many cases, it's very similar to what Yellowstone Boys and Girls Ranch was dealing with, is the ability to find a psychiatrist to work with. And what HealthLink now can do is bridge that gap and also do so in a timely fashion. So as long as schools, and it doesn't matter where in the state, are working within the CSCT program, we can come in and we'll be able to provide that piece because we can bill for Medicare, Medicaid, CHIP, and obviously it won't be too much Medicare. I don't know a lot of 68-year-olds in the second grade, so, but the CSCT program, that's what's so great about it, is it gives us psychiatrists, providers, Yellowstone Boys and Girls Ranch therapists the opportunity to help kids within in the schools. So as long as they're a part of that program, there's the opportunity for us to partner and work with them. Are there any other questions?
I'm curious, Kim or Christy, what's kind of the reaction from folks across the state with this partnership and getting it launched and this demonstration piece in Dillon, even from like maybe general ed teachers or other adults that work in the school environment?
You know, this is Kim. So far, I think the reaction has been somewhat skeptical. Not so much from the HealthLinkNow perspective, but I remember one of our first meetings with the Dillon administrators, one of the principals was like, good luck. You're not going to be able to find a psychiatrist who's willing to do this work in Montana. And that's what's been so great about HealthLinkNow from our perspective, is because they do all that recruiting. They're the ones that bring the provider on, and they've had a lot of success in doing so. And I would probably defer to Nick to speak a little bit of that, of how many child psychiatrists there actually are in the state of Montana and Wyoming, for example, and how many of those are actually accessible to kids. So I think right now, from the general public, there's been more skepticism. Let's see how this rolls out. And a lot of people initially are like, well, it should be face-to-face, and that's not what the statistics are supporting with this. That it's a new era. It's all about social media, and this is the kind of advancement that kids are most comfortable with. So it'll be really fun, and I'm sure there will be more challenges to come down our way, but right now we're just really excited to get things started and going. I'd love to come back and present when we have gotten it started and have some outcomes to share with everybody. But I would refer back to Nick in regards to the psychiatrists and the success that they've had in recruitment.
Well, as I mentioned earlier, psychiatrists, there's a major shortage in the United States. Alone, we're about 45,000 psychiatrists short in the United States. So to break that down into rural areas, a lot of absolutely no accessibility ever. And then when you get into specialized areas of psychiatry, such as pediatric psychiatrists, it's even the number dwindles even more. If you're looking at Montana, you're probably going to be looking at maybe a handful of pediatric psychiatrists throughout the entire state, and many times those are located in one area. Wyoming, for example, has only 24 licensed psychiatrists in the whole entire state, with half of them working in the state psychiatric hospital in Evanston. So what we're looking at there is being able to bring in a specialized form of psychiatry, such as pediatrics, has drawn a lot of interest from healthcare facilities, obviously outside of that, to different partnerships, as well as working in corrections and youth corrections. And so I would say that right now we have approximately 2 licensed psychiatrists working for HealthLinkNow in Montana, with 2 more that are in the process of getting licensed. So it's not easy to recruit because it's so scarce for pediatric psychiatrists, but one of the reasons why we're having some success recruiting is simply because of the convenience of working with us. One of our psychiatrists, our pediatric psychiatrist, works out of Brazil. She is down there working, her husband is working on his doctorates down there, and so she does all her consultations from home, a home office in Brazil. So to be able to increase our outreach to any location within the United States without having to bring the psychiatrist to a new location is a huge advantage for us.
Nick, could you tell us a little bit about what people could expect if, whether myself or, say, one of my family members was going to go through a psychiatric consultation with HealthLinkNow? What would that experience look like?
Sure, I'll just go from basically from step 1. In most circumstances, we're working with healthcare facilities. So an individual is going to be referred by their primary care provider. And what they're going to do is they are going to go to HealthLinkNow.com, and they are going to do a referral. The primary care provider or point of contact at that facility is going to do that. Now, in this case, there's points of contact at the schools in Dillon, and their YBGR staff, and they are going to be entering the referral for this particular student. And so they'll go to HealthLinkNow.com. It'll take 3 to 5 minutes to do the referral, and that'll go directly to a care navigator with HealthLinkNow. A care navigator is, to make it a little bit more easy to understand, it's like a case manager. And they're specifically one, depending on the potential referral rate, but one care navigator is assigned to that school. So they're dealing with the same individual, and there's some continuity in communication. That care navigator is going to speak with YBGR staff, as well as the parents and the students, to do a basic intake. And yeah, a clinical assessment, so to speak, and they'll do a basic intake, and then we'll work with the YBGR staff and the parents and the student to schedule the first consultation. That student's going to come into the assigned space, and they're going to sit down in front of the PC or the laptop, and they use a username and password to get into what we call our, I would call it our online waiting room, and the provider will come in on the other end when the appropriate time comes up. And during that consultation, there will be, I would say it's HD quality video transmission, so you're not getting any delayed speech and you're not getting any pixelation. And so they'll go through the consultation, and at the end of the consultation they'll hang up, and our provider will provide consultation notes to the appropriate YBGR staff, and we'll continue to go from there. So it's a pretty, to be quite honest, once you do this once or twice, it's a pretty simple process when it comes to a referral. And the same process would work if you were at a healthcare facility. The primary care provider makes the referral, the point of contact will contact our care navigator, and they'll work together to schedule the consultation, going through basically the same process.
Thank you. Any other questions from the participants? And Christy, Kim, and Nick, you all have your contact information up there, so are people free to contact you if they have more questions?
Absolutely.
Okay.
I love that.
Well, thank you for your time.
Yes. Thank you, Christy, Kim, and Nick, so much for making the time to be here, and everyone for your participation. Our next webinar will be September 4th, and Carl Roston will be talking about suicide and suicide prevention and resources in the state. Have a great rest of your week, and thank you again.